Hello, I am Karen and welcome to North Wales Aesthetics Clinic. Now every day I am asked, at what age should I start to have aesthetic treatments? Young people in their 20s call me and ask, should they start to have treatments now to prevent the ageing process? I also get calls from mature people, even in their 80s, asking me, is it too late? Or are they too old to have treatment? Well, I believe you are never too old to have aesthetic treatments, but you can be too young to have them. So I'm going to talk to you today about aesthetic treatments for the 20s to 80s age group. Now, we treat all ages in my clinic, but I have to say I treat very few people under the age of 40. When you are younger, in your 20s, your face and your neck is naturally lifted. The skin is plump and tight. So at this age, you may well start to see a few wrinkles on your forehead and when you raise your eyebrows, but you will not normally see any lines at rest. You may even see tiny little creases developing and fine lines developing around the eyes, or even a little tiny shadow underneath the eyes, but that can easily be remedied at your age with a light makeup. Because of youthful, tighter skin in your 20s, good bone structure, firm muscle, and plenty of tissue plumpness, should a young person in the 20s to 30s wish to have treatments, you may have some treatments that perhaps requirements will be very little, and the treatment will have better results and will last longer too. Now, younger faces are so much easier to treat, and people in their 20s to 30s usually only need a little definition, perhaps around the cheekbone here, or just on lips, a very small amount on the lips. However, when we get into our 30s to 40s age category, the aging process really starts to show. And at this age, you may aim for a smoothness, a natural fresh look, and improving minor aging issues in the view to avoiding surgery in later life. Now, this age group can benefit from starting treatments such as Botox in the forehead area and the crow's feet to relax the muscles that are excessively being used, and at the age of 30 to 40 are starting to crease the skin and causing lines of rest. Plumping tissue volume loss with derma filler should also be considered at this age, and you can also create a stunning lifting effect of the face with filler. And I also recommend skin tightening treatments to increase the collagen production at this age too. It is also at this age that we start to see the growth of lumps and bumps and skin lesions on the skin and small visible veins appearing around the nose and the cheeks area. And having them treated will not only bring a youthfulness back, but will award a smooth, flawless appearance. Now, the aim in your 30s to 40s age is to freshen you up and to tidy you up, and that's all. And the majority of people at this age are preventing deep lines at rest developing and halting the facial drop and sagging skin. Now, the 40s to 50s age category. So in this age category, you may require Botox treatment to the upper face to soften the lines that have developed at rest and further prevent lines becoming deeper. Treatment in the mid-face area here can take away the tear trough or the semicircle that develops at that age under the eyes, and lifting the mid-face, so lifting here, that starts this area that starts to sag in this age category is also a must. It may also be necessary to lift the corners of the mouth and start to address the marionette lines that go down here. And of course, skin tightening treatment in the 40s to 50s age group improves collagen and elasticity, and we can do that before you get into your late 50s. So the 50s to 60s age group is where the majority of our clients come in at that age, and which brings a considerable and noticeable loss of skin collagen and elasticity loss, and brings sagging of the skin, so you start to see the face dropping down a little bit. Also loss of the muscle tone and the muscle firmness, loss of facial definition due to gums receding and receding bones also becomes very evident. And over 50s, lines at rest are more noticeable, particularly on the forehead and in between the eyebrows and around the mouth and the chin. Under the eyes, the semicircle of the tear trough becomes well established, giving the face a tied all-day look. And the corners of the mouth here tend to tip down, get a little bit long, adding the fed-up all-day look. Now, due to the facial drop in your 50s, the jawline here becomes quite wavy and uneven as everything drops down. So in all, mature faces are quite complicated and complex and require very, very skilled practitioner. I treat mature faces day in and day out in my clinic, and treating a mature face, say over mid-55, is not the same as treating a younger face. Very sadly, and all too often, I see people in my clinic devastated by the results of a treatment at the hands of an inexperienced practitioner who has treated a mature face in the same way as treating a younger face, and the outcome is that you will look like you've had something done and your face has changed, or the symmetry and balance is not quite right, making you look odd. And the majority of my mature patients don't want to have surgery, so opt for the non-surgical facelift approach, and this is where you need to get the right practitioner. You can get the liquid facelift look with a combination of multiple treatments. So the right amount of treatment in the right place can make you look good for your age without you looking unnatural. But this is down to the skills of your practitioners, I've said. Some mature patients opt for treating only one or two areas to improve areas such as sunken hollow eyes or lifting the corners of the mouth. And most of them want to improve the overall texture of the skin too. So what I'm saying is, starting treatments in your 40s is a good starting age, and you can treat the areas of your face, skin and neck by providing plumpness and structure, improving skin quality and tightness, lifting the face, defining features, and adding a plumpness is definitely the way to go. And this will help you to avoid surgery in later life, especially if you are committed to having treatments long term. So correcting and preventing is the key at this age, in fact at any age really. Now for those of us who are people who are in the 70s or 80s, I believe in treating the areas that are aging the most significantly. So with treating things such as, being able to hide eye bags and adding much needed volume to the definition of the lips and treating pesky lines around the mouth area. So when treating a mature face and neck from 50 plus, aim to look good for your age. Never try to look younger. That's where you will start to look unnatural and different, and that's where things go wrong. Whatever your age, the natural way is a must. You must never be able to tell that somebody has had some treatment. However, changing your facial features so you are unrecognisable is a no-no. If your friends and relatives notice that you've had something done, it probably hasn't been done right. They should just comment on how good you look, how you look well rested, how you look good for your age, or you just look like you're sleeping better, or you've just had a holiday. Now, when people of any age come into my clinic, I start from scratch and keep firmly in mind the symmetry and balance, and enhance only what you have naturally. If you are at the age where you can see aging changes, then you can call me and let me show you and help you devise a plan of how we can freshen your face so you can regain how you used to look and be happy again to look at yourself in the mirror. So if you want to give us a call, we can book an appointment for you to come in and have a free consultation, and let's take it from there.